My name is Destiny Hawks, and today I'm going to talk about what depression is. Um, Depression is a mental health disorder characterized by persistent depressed moods or loss of interest in activity, causing significant impairment in daily life. There are four major causes of depression. They are family history, illness or health issues, medication, and personality. Family history, such as abuse or neglect, can cause depression. An increase in health, a decrease in health. Usually, elderly people face depression because of end of life decisions. When you read some of prescription bottles at the side effects, it sometimes tells you depression is a side effect. That is why you should always read your side effects when changing medications. When people suffer from personality disorders, they also sometimes suffer from depression. There are three levels of depression. These these three levels are mild, moderate, and severe. These three levels also come with 7 different forms. Mild depression involves more than just feeling blue temporarily. In some cases, your symptoms can go on for days. Mild depression can cause irritability or anger. Moderate depression is a feeling of sadness, loss, or anger, and decreased interest or pleasure in most activities. Severe depression can include feeling of hopelessness, increased irritability, loss of pleasure, trouble concentrating or sleeping, or thoughts of death or suicide. The 7 forms include major depression or major depressive disorder. You might have this type if you feel depressed most of the time for days of the most of the time for most days of the week. Persistent depressive disorder. This form lasts for 2 years or longer. Bipolar, also called maniac depression, has mood episodes that range from extremes of high energy with an up mood to low depressive periods. Seasonal affective disorder is a period of a major depression that most often happens during winter months when the days grow short and you get less sunlight. Psychotic depression, you have the symptoms of major depressive or psychotic symptoms such as hallucinations, delusions, and paranoia. Postpartum depression, women who have major depression in weeks or months after childbirth. Premenstrual disorder, or PMDD, happen at the start of women's periods. Atypical depression is a positive event, can temporarily improve your mood. Treatment-resistant depression. 1/3 of people treated for depression try several treatment method without success. If this happens, you probably have treatment-resistant depression. In conclusion, depression can be described differently and can show different levels in everyone that suffers from it. In many cases, depression can be treated and even possibly cured with the right treatment. Treatment is different for everyone. Some people may need a prescription. Some people could also go to therapy, but there are cases where both are needed for the best treatments. And then there are also cases where neither way can help their treatment.